Hello and welcome to the Mouthy Matters podcast. I'm so excited for you guys today because you get to meet the wonderful Dr. Joe Denning. He's a fabulous dentist up in Burnt Hills, New York, which is northwest of Albany. And I have had the opportunity to get to know Dr. Denning over the last couple of years, and I absolutely love what he is doing with his practice. When it comes to oral health care, he is just a fantastic leader. Their team is doing some exciting stuff. And we're also going to talk about, I don't know, I'd say it's maybe like a tricky topic that not enough people talk about, which is going to the dentist and feeling like you might be getting sold something. So we're going to get into all kinds of fun stuff. Thank you for being here, Dr. Denning.
Oh, it's an honor, Tosh. Thank you.
Awesome. Well, before we get into microscopy and protocols and all the wonderful things that you're doing, I want to ask first about how you kind of got into the space of, practicing oral health care, getting your patients healthy kind of differently. Like, did you have a patient that just had bleeding gums, didn't seem like they were getting healthy, and you just thought, man, like maybe this traditional model isn't working for me anymore? Was there a moment that you thought, I want to do things differently?
So it's kind of a long story. I'm a nerd. I've been a nerd my whole life, and I'm kind of philosophical, right? And I had a big birthday, so I recently turned 40, and I started, at that point you start, having different priorities, and I started focusing on my own health, and how I want the rest of my life to play out, and not just on aesthetics, but on longevity and feeling, we all want to feel good and live,
Yep.
As high a quality of life as we can. Right. And, I love my primary care doctor. I think he's great. But, I went to him, after that birthday, and I said, hey, is there anything I could be doing, differently? Are there any vitamins I should be taking? Is my diet? Can we discuss that? And, he kind of just looked at me puzzled and was like, your blood work's good. You're good.
Nothing to worry about.
Your BMI is good. Right. And it was kind of like, and I'm not knocking him. He's a great guy, but that's like this, to me, that represents the standard medical model, right? It's deeply reactive, right? We either check in a box of well or check in a box of illness, right? And I think this area of wellness, of optimization, right? I don't want to not be sick. I want to feel as well as I can feel, right? And so for me, that was kind of my own kind of journey to trying to find out, what can I do, to optimize my own wellness, right?
Yeah.
And then I thought, am I treating my patients any different than my doctor was treating me, right? Am I being reactive as well, right? And so that was the big eye opener. It's like, in a lot of ways, you come in for your checkup. If it's not, if it's not bleeding or not even that, if it's not painful, is it a problem, right? And am I doing everything I can to not just, keep my patients' teeth in their mouths, but make them healthy, right? And so that was kind of why I started looking in this area, this direction.
I love that. So when you were like, okay, so now step 2, how do I know for sure that my patients are healthy? What did you start to pursue? Like personally, did you just get on the message boards, get on Reddit, get on dental groups and go, microscopy, what do our protocols look like? How did that transition? Where did you start?
So I'm really, really lucky because I'm surrounded by a really smart, capable advisors and people, right? And to kind of put a plug for Shelly Renee, I mean, she's my consultant, and she's changed my life and my practice, right? And I've worked with her for years, and I trust her. And so there was an oral systemic kind of seminar, run by our friend, our mutual friend, Dr. Larkin. And she said, listen, you got to be there, take some time off. You need CEs anyway. Check out what's going on there, because I think, I think it will jive with what you're looking to do. Right. And I didn't know anything about microscopes. And I didn't even know there was going to be a microscope there. Right. And so I went to the meeting, and on the way to the restroom, they had the microscope set up with a screen, and I saw the biofilm for the first time. And I mean, my mind was blown and I was captivated instantly. And I was like, what is going on here? So that
Yeah.
really lit the fire. It was so compelling to me. I'm a dentist and I'm married to a dentist and all my friends are dentists, and so there's not a lot of things in dentistry that, you know, ignite that initial passion you have for the field, right?
Yeah. Yeah.
Um, and get you as excited as like, a young kid, right? But when I saw this, it was just so compelling that I was like, and I went back and without knowing much, bought a microscope for every operatory in my practice. I said, this is going to be the direction we go, because if it was so compelling to me and this is kind of my world, I knew
Mm-hmm.
I knew it would be compelling for my patients.
Yeah. So when you guys started taking slides on patients and showing them what was living in their mouth, not what did your team think of what they saw initially? Were they as shocked as you were from the event, just seeing, wow, that stuff is in my patient's mouth? Were they surprised by their findings?
So this is like a super hard area, and I'm just going to answer it truthfully. My team was really skeptical, right? And they were afraid that kind of I was sold a scam, you know.
Yeah.
Their doctor went away for a weekend and came back, and all of a sudden said, we're going to change the way we practice, and they're like, oh boy, what salesman got to him? Like what are we in store for? Kind of thing, right?
Yeah.
I was just so excited about it, right? And they were like, like anything else, change can be hard, and
Mm-hmm.
so they were super skeptical. But like, I've got an amazing team. They were skeptical in like a protective way, like, oh my gosh, what did they do to him?
Poor Dr.
Yeah,
Denny.
like, oh no, he bought
He
he bought
bought some snake oil.
5 microscopes. This guy, like, it's that kind of thing, right? But I will tell you, when the first one came and we hooked it up, um, and we put it on the screen, it was like they all were equally, if not more, excited than I was when we first saw it, and then their looks, were less skeptical, right? And
Yeah.
so
Yeah.
on board right away, because when you see it, when you see the reality of it, it's quite striking.
Yeah. I feel like it's so akin to when photography became like the big thing in dentistry, and we just started taking photos of everything and being able to show our patients. And it was like the veil was lifted. We no longer had to use all kinds of dental terms and terminology to try to explain to a patient that had something that didn't hurt, but looked very suspicious to us. And with like from a restorative standpoint, and for me, once I started using a microscope, I was shocked at what I could see on there in the blink of an eye. And I thought, oh my gosh, this is going to help explain to my patients the inflammation or the bleeding that I'm seeing so much easier, even though I was terrified to show my patients. Because I thought, what if they don't believe me? What if they think that everyone has this bacteria? And there was those kinds of conversations as well. How did your patients adapt to starting to look at a microscope slide? Were they really curious? Did you have anyone that felt like, I don't know, Dr. Denning, I think you're trying to sell me something?
I mean, you never know what's in the mind of others, right?
Yeah.
I hope not, right? I'm super blessed. I mean, I work in like the most amazing community. I have like the most amazing patients, and I've built their trust, over the years. And so I didn't have a lot of bad experiences. I really did. But also I was super earnest about my level of expertise with it, right? Like I didn't, initially anyway, I didn't roll it out like, hey, I have all the answers. I
Yeah.
rolled it out like, this is something really compelling. We're training the team right now. Would you like to look with me? And then we kind of like co-discovered what was going on, right? And
Yep.
so, and that can be hard, as I'm an expert, and I love what I do, and I speak with a lot of expertise on the things that I know about, right? And so when
Yep.
you're out of your comfort zone and you're expanding the scope of your practice, I think honesty is just the best policy. So, you just tell your patient, this is something new that we're all learning about together, right?
Yep.
Would you like, and it's not invasive, and it's not like, we're not learning something, scary together, right? So it's
Yep.
very
Yep.
invasive. You take a sample, just, as part of the regular exam. So there's no risk to doing it.
Yep.
We just started looking together, and if they had questions about, hey, what is that? And I didn't know, I was thankful to have you as a resource. I was thankful to have, other dentists doing this as a resource, and we'd get back to them and answer their question. Right. And so, with that level of honesty and earnestness, it was really well received, as just I'd like to, I hope so.
Yeah. I love that. I love that. I think that being able to show somebody any additional information is so valuable because all of us want to make informed decisions on our health, or at least I certainly do. And the more information that I have, the better choice I can make for myself. So if I go into the dentist and they tell me that I have bleeding, first thing now that I know that I have a microscope, it's like, well, let me look what's in there. And if I see some icky looking creepy crawlies, my next question is going to be, help me get these creepy crawlies out of there. So the difference between a traditional cleaning and a deep cleaning, I think for some people can feel a little bit confusing. If a patient's coming to the dentist every 6 months to get their teeth cleaned, and then all of a sudden they come in and we discover that they have some bleeding in their gum tissues. Maybe they had some bleeding before, but now all of a sudden we're taking a deeper look and we're looking at the microscope slide. We're taking a piece of plaque from their mouth and we see some really unhealthy bacteria. The conversation from like a deep cleaning, which is what we used to kind of call it, I would consider that maybe some older vocabulary, still used commonly, but doesn't really articulate what we want to be doing to get that person healthy. Do you feel like the microscope has helped those conversations for your team? So if they see inflammation and bleeding in somebody's mouth that doesn't come in with any pain, they have no idea that they have a problem, but then the team is able to show them a microscope slide with bacteria that's not part of health. Do you think patients are more accepting and understand and realize like, oh, I just came in contact with some bacteria and now my mouth is sick? Do you think that conversation is easier or has changed in any way?
I'm not sure. I don't know. Right? There's so much wrong with what's going on there that's difficult to answer. Right? Like the terminology itself, like if you're calling it a deep cleaning or even what the codes are now, scaling and root planing, it's
Mm-hmm.
such an antiquated, um, ill-conceived, from the initial, how do I want to say it? From the initial conception, it's ill-conceived, right? So like scaling and I'm talking to a hygienist, so please correct me if I'm wrong.
You're great. You're great.
Right? Like, so there's a tooth and it has something called cementum, and that's the covering that's on the root, right? And so that's a really rough surface, and it needs to be rough biologically because that's where the fibers that hold your tooth in are hooked on, right? And so with disease process, you can lose gum and bone and expose some of that rough surface, right? And so scaling and root planing was just that planing roots. So you're taking a sickle, right? Like metal object, and you're digging under the gum, and then you're planing the root. You're trying to literally remove the material off the cementum to make it smoother, right? And so like that, so that's the code.
Sounds so barbaric, Dr. Denny.
Well, because like it is, right? And
I agree.
because like what are we assuming? And let's talk about the assumptions in that treatment, right? The assumptions for that treatment is it's the rough surface that's the culprit, right? And so it's like ignoring the etiology of the disease, which is the bacteria that's there, right?
Yep.
And so we can make it as smooth as glass. And if you have bed bugs in the mouth, there's going to be inflammation and disease, right?
Yep.
And so so the whole thing is wrong, right?
Yep.
And so for me, it's not even discussing a deep cleaning or a scaling and root planing or anything like that. It's about we're going to manage this ecology in your mouth, right?
Yep.
And so it's an entirely different discussion. It's a discussion that's based on the actual, you know, biology and science of the disease, right? And so
Yep.
it's not even as if I'm defending that treatment. We're not doing that, right? We're doing something radically different, right?
Yep.
And we talk about the different instruments involved, different technologies involved. But it's not an individual tool or technique, it's a concept, right? And the concept is managing that mouth, right? Just like I was imagining the mouth as a forest, right? And it once had a healthy, balanced ecology with all the animals and plants and all the organisms living in harmony, right? And now we have an invasive species, a nasty predator that's in there, right? And it's disrupted the whole biology. It changes what's living there, right? It's no longer healthy. We want to go in there and selectively eradicate these invasive organisms, right? And so it's just an entirely different conversation, right? And
It
so
is.
and when you're having it at that high level, and what's really cool, right, about 2026 is, people are really smart. I don't know if it's all the podcasts like this or AI, or it's just like we were always this smart, but we didn't know it. Like, these are super high level conversations. I have them every day, and it's like we're not losing our patients in this. They're fascinated
Yep.
by it, they follow it, they get it, and then it's like, oh, okay, this is an entirely different approach
Yep.
to what came before it. I don't know if that answered your question, but
No, it does. I totally agree. I mean, when I started showing people the unhealthy bacteria, the conversation completely changed. It changed from a dirty mouth problem is how I feel like we used to talk about gum disease, gum infections, gingivitis, or periodontal disease. We used to talk about how we need to get in those nooks and crannies and really dig around and scrape and all the things that sound very painful and like nobody would want. But once we can show them that this is just like any other infection, you came in contact with some unhealthy bacteria, your mouth got sick, your immune system didn't fight it off. I love your analogy of, yeah, there's an invasive species in there. Let's get it out so things can return to balance. It's all the focus of the conversation completely shifts from, to me, it's like, well, if somebody's been coming in every 6 months and they're doing a really good job at home, and then all of a sudden they get an infection, the old model was a bit of a lecture for some patients. Like, oh, Dr. Denning, you weren't brushing and flossing well enough. Oh, you didn't make that C shape with that floss. Oh, you must have been slacking off. Whereas for the most part, that's never true. Like, somebody doesn't get strep throat and you go, well, you really weren't cleaning your throat well enough. We would never think that.
Yeah, it makes sense. Like, our treatment in the dental field was mechanically focused, and our home care was equally mechanically focused, as if the
Yep.
problem is a mechanical problem when it's a biological one.
Yep. Yep. So within your practice, when you guys are doing, I like to call it like medicated therapy, a medicated cleaning, something more like that, something that's more using antimicrobials, targeted treatment to really cleanse and lavage the mouth and to get rid of those unhealthy bacteria, and then train our patients the same. So do you guys handle that type of cleaning different now using the microscope and some updated protocols than you did before? What does that look like in your office?
Yeah, it's not even the same office, right? And what really, at the end of the day, all this is nice, and I'm a nerd, like I said, so I like technology, and it's all really cool. But at the end of the day, 6 months later, your patient's healthy, and
Mm-hmm.
they feel better, and they're jazzed about it, and they notice a difference, not just about how they look, how the gum looks, but how they feel. And now they're caring for themselves at a higher level. We've empowered them and given them the tools to be healthier. Who wouldn't want to go to work every day and do that? So that's the best, right? So yeah, it's changed the approach, but really it's turned us into more coaching, and like co-partners in their health.
Yep.
Then we're doing something to them.
Yep. Yep. I love it. I love it. Let's switch gears here a little bit and talk about the elephant that's in a lot of dental practices, and maybe the elephant that's in a lot of people's mind before they walk into a dental practice. I know I've definitely in my career had some patients that just walk in even as a new patient and they feel kind of guarded. They're worried that we're going to try to sell them something, or, they know they need to go to the dentist to get their teeth clean. They maybe, took a slight dental sabbatical and they come in and they're afraid of the price tag on the treatment plan, really being able to understand, do I need this? How do you handle the skeptics in your practice? And I mean, for me, I think it's all about communication, and being able to show versus tell. Have you had any patients ever that just were uncertain and you were able to shine a light for them on why they needed treatment that they maybe weren't certain about before?
So I'm going to try and answer your question, but I'm going to pick it apart a little bit if you don't mind.
Do it.
That's like presupposing I have an agenda ahead of meeting them, right? Which I really try and not do, right? Like I think what you're asking is like, are patients being felt like they're being sold to, right?
Yeah. Yeah.
Right? Is that
Yep.
is
Yep.
that-
Yep.
when you feel sold to, I think the main component is the person selling something to you is talking about what they need and want. They're focused on themselves rather than what you need and want, right? And so
Sure.
nobody wants to be sold anything. That means that person has a pre-assigned agenda, right? They were gonna, it's about them. It's about what they need. It's about what they think. It might even be selfish, but it's about their own personal philosophy that they want to like push on you, right?
Yep. Yep.
Being sold to, right? So I try, right, and we kind of frame this from our first meeting in our comprehensive exam. I want to talk about what you think's important, right? I have an obligation as your doctor to like not neglect you, and there's things I have to tell you. If it's there, I have to tell you about. But I really, really try my hardest to talk about why you're here first, right? And I
Yep.
think if you do that, it's a very human gesture. It's genuine. Like I'm not pretending. I really do want to know
Yeah.
why you're here today, right?
Yep.
And if we can address that together first, right? And I can talk about what you're concerned about, and we can find a solution to your problem, right? First, then I think that's the beginning of a relationship, right? And then everything kind of flows, from there, right? So when I meet somebody, I don't know why they're here, right? And so
Yeah.
that makes sense.
Absolutely. Absolutely. I love it. I love it. So if as we're in regards to oral health, is there anything that you wish all of your patients knew before they step foot into your practice or any practice? So this isn't necessarily your practice. So for any listener out there like that's going into a dental practice as in regards to the health of their gum tissue, the health of their mouth, and how it relates to the rest of their body, is there anything that you just wish like everyone just knew? Like it just became a plain old fact, common knowledge.
It's interesting because like I'm really, really blessed. I went to Stony Brook Dental School, and they have an oral medicine program, and it was really like the first of its kind in the country in the 70s, right? And they were focused on all this stuff. And this is not new research, right? So like I remember from year one hearing about the link between cardiovascular disease and the oral, your oral health. The link between diabetic control and bacteria that's in the mouth. And like we studied it and we learned it, but it was academic, right? And so we learned all of that, and I was blessed to learn that. And then, you go out on the clinic floor and, you're taking a metal stick and you're measuring the gums, and it's a deep cleaning or a regular cleaning kind of thing. And so it becomes very academic, and it's like, okay. And I'm a real practical kind of person, and so if it doesn't change my behavior, it doesn't mean much to me, right?
Right.
So we had all of this information for the last 50, 60 years, right? And I don't think anybody's talking about it. I don't think it's out of neglect or a lack of concern. It's just there was never a really great way to bring it practically to the chair Monday morning, right? And I think that's what's great about the microscope, and not just the microscope, bacterial testing, which we might want to get into if you like. But it's, we can now visualize and see the offenders. We can test for the offenders. It's a real thing, right? And
Mhm.
and now we can, we can inform patients of this in a meaningful way rather than in a general way. That makes
Yeah.
sense?
Yes, absolutely. One last question. So, for patients that are going in to the dental practice and maybe they don't get to come up to your practice at Lake Hill, but if they were going to their practice and they're thinking to themselves, I know my hygienist has talked about having bleeding gums before. I remember my dentist talking about it, but they just did a cleaning and told me to brush or floss more. Is there anything that you would recommend that patient ask the next time they go get their teeth cleaned, whether they're asking their dental hygienist or their dentist? Like, is there specific questions that might help them to better understand their oral health?
That's really tricky. I guess I would ask, are you seeing anything that is indicating that I have inflammation, right? Because we know inflammation is bad, right? Like you're never going to hear like, hey, great news, this is inflamed, right? It's just bad news,
Absolutely.
right? It's just bad news, right? And I think like the future of like medicine is going to be, we're going to find out all these diseases are like one etiology, right? Like you have inflammation in your brain, you have Alzheimer's. Inflammation in your heart, you have cardiovascular disease. So you know what I'm getting at, right? So
Yep.
that
Yep.
as the root cause, right? And we have individual genetics, we have individual like behavior, environmental exposures that make us, express disease in one way or the other, one particular illness or another, but the root cause is inflammation, right? And so, do I have inflammation is a good question, right? You know,
Yes.
and you don't need a microscope to know that, right?
No.
And I don't want anybody to think like a dentist that doesn't have this is a bad dentist, right? I
No,
didn't
of course not.
I
There's
didn't
so many
have
ways to
right,
practice.
and there's many ways to do it, right? Traditional methods can still work. It makes our job easier with the new tools. There's no doubt about that,
Mhm. Yep.
right? But that's a place to start. Do you see inflammation, right? And what can we do to manage it, right? And then the means and the methods to which you do so are at least grounded in the right focus.
Yes. Yes. It's not just about having a clean mouth. It's one without inflammation, one without bleeding. 100%. I love it. Are there any final thoughts that you would like to share with our audience? Anything that we didn't cover?
Um, well, it's your audience is a general audience, right? But there might be dental professionals.
Absolutely.
Um, I've just got to have a big hug out there to our hygienist colleagues, right? I'm on the Facebook groups. I read the forums. There's some. I don't want to say it. There's some tension right now in the field. I don't know if you know what I'm getting at.
Yep.
And
Yep.
so we're colleagues, right? And we
Mhm.
can't do our job without you, and you can't do our job without us, right?
Yep.
And
Yep.
and part of what I've truly loved about changing this approach in my practice is that we've been able to make them the stars of the show, right? We've been able, because prevention is worth an ounce of cure, right? They're at the front lines. I think for a long time, you guys have been overtrained and underutilized, right? And you have a lot to offer, our patients. You have a lot to offer the dental community. And I think this is a great way for us all to do this together, make our patients healthier, make our practices more attractive for patients. And it's
Yeah.
win-win for everybody. So that's been probably the most rewarding part of this whole thing is watching my very capable team blossom and take this on and become better versions of the professionals I know they want to be.
I love that, Dr. Denning, so very much. I'm going to say nothing else because I couldn't end this podcast on a better note than that. Thank you so much.
No, thank you. It's been a pleasure.
Awesome.